Welcome back, and we continue talking wellness here with Dr. Norman Bryan. And Doctor, your practice is all about dental medicine, and the technology these days is incredible, isn't it?
It is indeed. In my 36 years, I've seen an amazing advancement in technology, and we've tried to take advantage of that. And some of the new things that patients will see when they come in for their first examination are, as we alluded to before, the Velscope, which is an instrument that produces a light, and the light is a fluorescent light that actually will show any tissue that is, for example, an unusual tissue that's not normal oral tissue. Shows up very vividly through our screen. So when we do an examination of a person's mouth, we look at all the soft tissue in their mouth, and we can determine from this instrument whether there's some areas of concern that may need a biopsy, may need attention. So very valuable instrument that has come into play in the last couple of years, funded by the NIH, and we really feel this is a valuable tool to us to determine if there is anything in there that's a serious problem.
So needless to say, you've probably spared some people, some patients, maybe some problems down the road by catching things early, huh?
Oral cancer is such a devastating disease. It is one of the few cancers that only has a 50% survival rate. And when you can see it visually, very often it's in the third or fourth stage. This allows us to see precancerous tissue, so obviously we feel it's very important.
And some of the other technologies there, Doctor?
Well, for new patients, we have a thing here called the Diagnodent, and it's a little laser beam that we can show on each individual tooth. And we can point this into a tooth that maybe we couldn't feel any decay, but it'll tell us if indeed there is decay digitally on this little screen. If the screen will read a high number, let's say 25 or more, then we understand that there is something going on underneath, let's say a crack or a fracture or a fissure that would need more attention. So again, a valuable tool to determine if we do have a decay problem that isn't automatically visible.
Probably something you didn't have 36 years ago, huh?
No, we didn't have that 10 years ago.
What about that third item over there?
Well, this here is a very valuable, this is called the wand. And if you need treatment, obviously people are frightened to get injections. That's one of the things that keeps people away from the dentist. And this is an electronic injector. And it's a very, I don't want to ever say comfortable, but let's say it's a instrument that is a lot easier than the old stainless steel needle that we used to deliver. It's electronic. It is got a computer in there that determines the pressure that we can apply in the injection. So consequently, if we do small bits of injection, it makes it much more comfortable. It's very specific to a specific tooth, so you don't get the generalized anesthesia that you do with the larger needles and the greater application of the anesthesia. So I'm very happy with that instrument. People really appreciate it.
Yes, indeed. I, for one, an incredible piece of technology.
Right.
Now, when new patients come here, Doctor, can they expect to receive treatment from you using some of this technology?
Absolutely. Our first appointment, obviously, we want to sit down with a patient, explain what's going on. If they need treatment, in some cases, if it's immediate treatment, something is really seriously bothering them, we'll try to get them in right away or take care of it immediately. But our first appointment certainly is just to determine what their needs are, kind of give them an overall view of what's important, and give them a priority list of what we feel is their most important issues.
All right, Doctor, we're going to continue talking about items that pertain to the dental office and going much beyond that in the coming weeks, but thanks for your time today.
You're welcome, Craig. Thanks for coming.
You bet. Dr. Norman Bryan and Dr. Anjana Gupta here on the show Fresh as we talk wellness. We'll be back in just a bit. Stay tuned.